So the order's in the computer, but I also had to put in some labs. So I had to put in a lab for type and cross match and some labs for tomorrow morning so they can actually see the values. So we're waiting for a lab to come up, and they're gonna draw some blood. And when they draw blood, we wanna make sure that they put a little number on his armband. It's called a unit number. You wanna have that unit number. Mr. Campo, I'm just gonna reach over here and we're gonna look at your armband. There's gonna be a little unit number. Let me see what they did with this one. Can you see if there's a number on here or here? Right there. They're gonna put that little number there. If they don't do it on the armband, they will give them a new armband, just a plain one, and the number will be on there. It's very important because that is going to identify his blood. So it's gonna go actually through the whole process, and when they bring the blood bag back and they say his blood is ready, that little number will be on his label. So we want to make sure that that's our responsibility, because sometimes they forget, so I have to call them back and say, there's no unit number on here. Please come back and do it. So you have to do that. So I'm going to go in there to talk to Mr. Campo. Mr. Campo, good afternoon. My name is Molly, and I'm here to talk to you about blood transfusion today. Did your doctor say anything to you about that? He did? Did he explain the procedure to you? Okay, he told you why you're getting it. He gave you a reason. All right. Do you have any questions for me about that right now? Okay, if you have questions later, and I will try to answer them. If I can't, then I will call the doctor and you can have a conversation with them. Is that okay? All right, so first what I need to do is I have a consent. I have a consent here that says that you're gonna get a transfusion today, and the doctor is Dr. Smith. And in order for me to give you this blood, I need to have your signature on this little block right here where it has the X already X'd up. You're gonna sign your name right here. All right, so I would give him a pen and he would sign his name. Do you have any problem signing, or do you sign all your documents? You do? Okay, so if you did, I would ask you who is the person I'm supposed to be talking to, but you can sign your own documents. Good. So he signs his document, and I have to sign here because I'm gonna be the witness. So I sign my name here, date and time, okay, print my name, date and time. And then when Dr. Smith comes over today to check up on him, he has to sign also. Even though we printed his name, he has to sign. They have to have a signature, okay? So then, okay, Mr. Ocampo, you sign here. What I need to do now is I'm gonna go gather my equipment. At the same time, I'm gonna go and deliver this in the right place where it's supposed to be. I'm gonna go get my equipment, and then I'm gonna come back and I'm gonna look at this saline lot because I need to see how it's going to flush. So I'm gonna be flushing in a couple of minutes. Do you remember when that was put in? You do not? Okay, since I'm here, I'm just gonna look at it. I'm just gonna look to see if there's a date, a time, and if there's no date and time, you can flush it. And if it doesn't feel good to you, we have to start a new one. All right. So what I would do is, depending on my time frame here, if it flushes well, I'll use it. He's not complaining. But if not, I'll find out when they actually would put in. It would tell me how many hours it's been here, and then I would go and start one on that side. Okay. You really need to make sure you have a fresh one because blood transfusion is going to run over 4 hours. So you have to have a good IV site. All right. Okay. So I'm going to go deliver that. I'm just going to say that I went there to do that. Okay. So there's a place where they're keeping actually hard copy consents, and they will let you know, your unit will let you know where they're being kept. That way, if you need to retrieve it back or somebody wants to look at it, they'll be able to find it. Okay. So what I'm looking at is this, but we don't really need this minute. I just need to focus on his saline lot, and I need to focus on flushing it. And so I have to do all these things today before I start the transfusion. It's called a pre-transfusion phase. So I got a consent. The lab's gonna come and draw the blood. And then if there is a problem, I can call the physician with any problem about drawing the blood. We're gonna check to see if there's a unit number, okay? If I draw the blood, I'm gonna take the tubes myself to the lab to make sure they get there and they can start getting the blood ready for me. Ask him any questions. Mr. Ocampo, since I'm here, have you ever had a blood transfusion before? None. Okay, and I think I already asked you about allergies. You have no allergies to tape, food, anything you can remember? Okay, so then I did that already, and then I have to look at the catheter, the IV catheter. There should be a date on here, and they will tell you when it was put in, but I'm gonna look at the color of the catheter, and I'm gonna push it in this way. It looks like this catheter is gonna be a size 18. So you pick the size that day, okay? Size 18. It could be an 18 or a 20, all right? I'm gonna flush it right now, and I'm gonna flush it with 5 mLs of normal saline. And then I'm gonna check to see if he has any pain or discomfort when we're flushing. And then I'm pretty much done with this, except before I leave, I'm gonna start the saline. I'm gonna just prime it, and I'm not gonna attach it to a saline line. All right, Mr. Campo, I'm gonna wash my hands really well, and I don't have to wear gloves right now, but I do have to wear gloves when I start the blood. So I'm gonna go ahead and take my flush with me. I'll make sure it's not expired, and it is normal saline. We wanna make sure, and this is brand new, so it will be taken out of the wrapper. I'm gonna go ahead and see if I can get this air out of here, because there's some air, I see it. So I'm gonna pull back and then push back really slow. There's still a little bubble there. Push back. That's better. Okay, I'm gonna go ahead and tear off my alcohol pad, and I need to have it so I can clean the hub for 15 seconds, okay? Clean it really well, and you're going to attach. I think they used this one before and they didn't flush it. Okay, so I'm gonna go ahead and flush 5 mLs, but I'm gonna pull back. I wanna see if there's any blood return. Oh, there is blood return. So I'm gonna go ahead and flush 5 mLs, okay? All right, Mr. Ocampo, I'm gonna start flushing. I want you to let me know if you have any discomfort, like burning, pain, anything that is abnormal to you, let me know and I'll stop, okay? That means that we might have to start another site somewhere, all right? Okay, here we go, we're just flushing. Just let me know how you're feeling, any discomfort. Okay, just keep going. We're almost there. Okay, almost there. All right, we did it. It's 5 mLs. Any discomfort that you want to tell me about? Nothing? All right, so it looks like it's flushing really well. So we're gonna be able to use this site. The blood is going to run over a 4-hour period. So I'm gonna get some of my work done right now, and then I'm gonna wait for them to call me from the lab when they have your blood ready, okay? So then this goes into the trash, but with my other ones over there, okay? And then I'm going to just go over here and get some sanitizer to make sure that I do have this, and some gloves. Medium or short, or
small.
Yes. I want to make sure. Can you give me 2 pair? Because I usually have to use one at the end. All right. So I'm going to go ahead and put my sanitizer over here for me. Here, and so okay. So I did all my pre-transfusion requirements, and then I'm going to turn over my page, and I'm going to make sure that I have all my equipment. I have normal saline, and I have some pre-filled syringes. I have to get more. I have alcohol swabs, and I have my gloves, alcohol. I have an IV pump. I don't have to worry about that. And then I'm going to, before I leave the room, I'm going to prime my tubing. After I'm done, I'm going to go out to the lobby or out to the hallway, and I'm going to ask 2 nurses that work on this side of the hallway with me, if one of them will be able to check blood with me when I come back from the lab. I'll let them know when I'm going to be doing that, all right? Because I have a time frame that when I pick up my blood and come back, from the time I leave their door and come back to the unit, I have 30 minutes to hang this blood, so 5 of it's gone already. I have to go and talk to that nurse that I already made arrangements and ask her, can you come in the room now so we can read blood, okay? So that's what I have to do. So again, blood's gonna infuse in 4 hours. Okay, and I'm gonna be checking all that all those checks when that person comes. So I'm just gonna leave it like it is for right now, okay? All right, so I got my saline. I'm gonna open it up from the wrapper. I'm gonna check for expiration date, anything that's floating, and my expiration date may be up here. Okay, so it's not expired, all right? Okay, so then I'm gonna look at my tubing. This is blood tubing, and I'm gonna check for expiration date. Sometimes their expiration date is here in the front. It's not expired, okay? But I am gonna wear gloves for this because I see that there is some residue from the other infusion that we did, so we wanna make sure that we don't get anything on our fingers. So I'm gonna go ahead and look at my tubing because I need to clamp all the sliding clamps, all the sliders, anything that's here. Okay, I'm gonna look at it. I wanna keep it coiled as much as I can, and I'm gonna make sure that all my clamps are closed, and any slider like this one slides, I'm gonna close them, and I'm gonna close this one. We don't need them open at this moment. There's one, no, that one's closed, this one's closed. Okay, there's 3 total, all right, and my spikes are here. I'm gonna make sure that I don't take the cap off until I meet them, all right. So what I'm gonna do now is I'm gonna get my saline because we have to prime it. So here's my priming solution, and I'm not gonna do anything else with it other than get it ready. I'm gonna coil the tube and put it up here because I don't need it this minute. I'm just getting as much as I can get ready before they actually, I'm called from the lab where the blood is ready. So we're gonna go in here, take the one that has the little pigtail, the little blue port on here, not this flat one here. We're gonna go back and forth a little bit more. Okay, you wanna see the spike way down here. Okay, so now I can go ahead and invert. And we're gonna hang it because I need to have two hands. Okay. We're just gonna say that there is a cap here because it's like floating everywhere. All right, so I need to get some fluid into the chamber, and I need to have the fluid way up here, above this white ring. So there's gonna be a lot of squeezing. Open, keep this closed and open the saline. Keep squeezing until you have the fluid way up here. It's gonna take a few squeezes. Okay, about right there. Okay, that's good right here. Okay, all right, so now I'm gonna slowly start opening the tubing so it will release all of the air that I see in here. It's gonna cause a problem if you don't release it. All right, I'm gonna go ahead and move this back because I need to be a little bit closer to this bucket. This is my sink for today. Okay, so we're gonna go ahead and open it slowly. I wanna see, I'm gonna be looking at the chamber here. I wanna see drops. All right, let's open it up a little bit more. There it is. Okay, now it's picking up. There it goes. Okay, so now we're just letting all this air travel. There's a lot of air in this one. We're just letting it travel. We want it out of here. It's gonna take a few minutes because sometimes it gets trapped in here. Okay. It looks like it's all out. All right. So we're gonna go ahead and close it here. By closing down, it closes it. And I don't need it at this moment. So I'm gonna make sure that I keep the cap on there. And I'm gonna go ahead and put it and hook it up here. But before that, before I say that I'm done, I'm gonna see if I can prime this part here. Okay, let's see how much I'm gonna need. Okay, it's gonna be a little difficult because I'm way over here, so I'm gonna turn the pump. Maybe, am I helping? When you open this, okay, this is open. When you open this one, do it very slow because it comes out super fast. Okay, and you're gonna have to have 2 hands. Just barely open it. Let me see where I am. There's air. Close it. Okay, it's done. I see another bubble though. Trailing behind. Okay, there we go. So then I would put the cap back on here. So this is done. I'm just gonna leave it like that. All right. Okay, so I'm done. I'm gonna go and take care of whatever else I need to take care of right now. And then we're gonna say that the lab called me and that my blood is ready. Okay, so we're just kind of move it forward so we can get the skill done. I'm gonna take my gloves off and then I'm gonna use some hand sanitizer. Okay, so if I have not arranged my time with the other nurse, I want that nurse to help me, I'll do it right now. Okay. I'm also going to take some vital signs from him because I need to have those vital signs to put on my paper, the very first vital signs. I need to have them before I start the transfusion. And I need to know whether he's running a temperature, what his blood pressure is. So sometimes that's really very necessary because I have time now to call the doctor if I do need to do something with that. If he has a temperature, I can always give him some Tylenol. If I don't have any Tylenol, then this is a good time to get one. So we're just gonna make up our numbers here so I can have something to, let's see. We'll just say he's breathing very normal and we'll say his pulse is running like a 76. And blood pressure. I'm gonna make his blood pressure in the 130s because he always runs high in the 130s. So we're gonna start with 136 over 82. I'm gonna keep this here because when I come back, I need to put these vital signs on my paperwork. So I'm gonna keep them right there. All right, so now, Mr. Ocampo, I'm going to go to the lab. They already called me and your blood is ready. So I'm gonna go down there and get your blood and come back. When I come back, I'm gonna have another nurse come in here. We're both gonna be looking at all the labels. We're gonna read the labels together. And then when we're done, then I'll start the blood. So I'll let you know when that's gonna happen, okay? So you wanna talk to them throughout the process so they can feel that they're kind of part of the blood transfusion. And if they have any questions, they'll be able to ask you. So right now, the only thing I have left here is I already took his armband. I need to go and find a nurse and ask them if they will be my signature nurse. And then we're gonna read all the labels here, okay? All right, and then I'll be ready for the transfusion, all right? So I'm gonna step outside and I'm going to say that is my lab over there, so. It's over there. Put my paper. I'm gonna call it that. I'm gonna put the paperwork back. All right, so let's say that this is his paperwork. I'm gonna go grab it. Let me. All right. And we'll see each other on Saturday.
I'll see you on Saturday.
Okay. Before I left, I already asked one of the nurses to come in here and read blood with me, and so they'll be here shortly. Meanwhile, while I'm waiting for them, Mr. Ocampo, we're back and we're gonna start blood transfusion in just a minute. While I'm waiting, I'm going to do something here. So I'm gonna backtrack a little bit. before you leave there, you want to make sure that the tech or whoever helped you, they sign here, time and their initials, okay, and then my initials here, okay, and then I'm working in a hospital on the West Wing, 4th West, okay, and then time, I guess we'll make it 3:30 to make it more. I was there at 3:30, okay. And I'm waiting and waiting, so I'm going to look at these boxes very quickly. I'm going to go ahead and check them up because I have all this and I did all this. The transfusion record is here, okay, and compatibility labels are in the back. And I have an order to actually transfuse blood today. The blood bag is here, and compatibility labels again are in the back. Transfusion record, this is transfusion record here, so I'm ready. Okay, so when that person comes, they're gonna read blood with me, and I'm gonna sign here, and then they're gonna sign here. Okay. Okay. So we'll just keep going. Okay. I'm gonna say that this is them. I'll just say, how's that? That's their signature. Today's date. Yeah. And today's date. So I'm pretty ready now. I already took the first vital signs, so I'm gonna go ahead and put them in there in a couple of minutes when I have more time. But in order for me to start this transfusion, I need to make sure that I run this blood in 4 hours, but I need to do a test dose. So my test dose is gonna be for 15 minutes, the first 15 minutes of the transfusion, and then it's going to be running at 60 ml, 60. Okay, that's the facility's choice. They chose that rate for this particular test, okay? So I'm gonna wash my hands, and I'm gonna put on my gloves. And I'm going to be reading blood first with another nurse. All right. Okay, so I need to go over there because I need to be near his armband, so I'm gonna maneuver myself over there, and we're gonna say that the other nurse is here, and they're looking at this. So I'll take it with me, and I'll be both people right now. So I have the blood bag, they have the record, okay? Mr. Campo, we're just about ready to start your transfusion. However, I need some time here to look at your armband, and I need you to verbalize your first and last name for me. Okay, so go ahead and tell me what your first and last name, and I'm listening. So I'm looking at this right here, and then I can take over. So his medical record number is 0217731. He has no allergies. Mr. Ocampo is O negative. Unit number is 12345. Okay, and the components here is PAC RBCs, and there's 450 in this volume. Okay, and let's see what else I need to write. I think that is it. Okay, Mr. Ocampo, I'm just gonna cover you up again, and we're gonna be ready now to go ahead and start the transfusion. I'm gonna sign here, and that person signs over here. And let's see. I didn't have to, but I did cleanse the pores for 15 seconds, sorry about that. And now I'm gonna go ahead and start the blood. Okay, so I did pretty much all of this now. I'm going over here to go ahead and start my blood. And I will fill this paperwork up during his 15-minute phase, okay? All right. Okay, Mr. Ocampo, I am going to be starting the blood now. It's gonna be just a couple of minutes. I'm just gonna have you relax. There's nothing for you to do, just relax. If you have any questions though, you can go ahead and ask me, all right? So I'm gonna go ahead and take my blood down, my tubing down, and both bags can be even. You don't need a hanger for this. Okay, so I'm gonna look to see which one has been used. We're gonna use this one. But when you bring it back from the lab, they both will be sealed. So just pick one. It doesn't matter which one, just pick one, but not both. You don't open both, because then you may have a leakage there. All right. So I'm going to take the cover off here. I don't need it anymore, and we're going to go right into here at a 90-degree angle. Before I do anything, I'm going to go ahead and close my saline. I don't need it anymore. Close. And I want to make sure I see my spike right there. So I can go ahead and invert now. And now remember, this is close, and this is close right now. In a couple of seconds, I'm going to open the blood. Okay. All right. And there's enough fluid. There's a little bubble here. Get it out. I'm going to give it a little bit more, though. It looks like I lost some when I was priming, so I'm going to give it some more fluid. Right there. Okay, close it. Okay, close. All right, so now I'm going to go ahead and help this. I'm going to open it up, and I give it just one squeeze. Let's see. There, that's all you need to do. Okay, close, open, see? Okay, you do not have them both open, because what happens, the blood will come here and it will go backwards. All right, so now we're gonna start slowly. I'm going to keep these two fingers about right there. There's about 2 inches right there. I'm gonna stop my blood when I see it there, so I don't lose any of the cells. Okay, so I'm gonna go ahead and start opening it up. It's going to take a couple of seconds for it to get the pressure going, and okay, so at first it's going to start looking like a light pink color, and then as it travels, the pink color will turn a little bit more red. Okay, so I'm going to keep looking at the blood as it flows. I want to stop it when I see some color right here. So it's going to be a few minutes. I can give it a little bit more help by opening it this way, and make it go a little bit faster. Okay, it's getting closer to my hand. See, the color is turning darker. Okay. All right, I'm almost there. I'm going to go ahead and close it. All right, that will guarantee that I'm not going to lose his cells. All right, so now what I'm going to do is I'm going to go ahead and clean his port again, and then I'm going to attach. There we go. All right, Mr. Campo, I'm going to clean your port with some alcohol here, and we're going to attach. And we're going to start your transfusion slowly. I'm going to run a slow test to make sure that if you're going to have any problems with the blood, we'll catch it early and we'll stop it, okay? So I'm going to go ahead and attach. Okay. And now I'm going to go ahead and put this back on the pump. Up a little bit gently. It should just fall in there. Make sure all the grooves are flat so you don't puncture the tubing, and then hold it down, shut it, and then go ahead and turn it on. 4 seconds and then let go. So we're going to be using the A1. And then confirm it. And then say, well, no, he's not new. And it didn't give us any options, so I'm just going to go straight to channel select. And I'm going to run a test dose. The rate for the test dose is 60. Okay. And then the volume in here is going to be 450.
You're going to have to delete. You did 604.
Yeah. Come on. And then what I'm going to do is just put a new rate and see if it'll take it. No? Okay. Clear. Sometimes there. Sometimes these buttons are a little slow. They're sluggish now because they've been used so much. So now. Okay, good. Okay, so now it's 4. All right. So we're ready to go. Okay, so now the saline is closed. The blood is open. Okay. And now I'm going to go ahead and open the slider clamp here. If he has a clamp here, I'm going to open that one also. Make sure there's no kinks. This tubing wants to kink on me, so it's been used, I think, a couple of times. All right, so I'm going to go ahead and start it. All right, Mr. Ocampo, we are going to be starting your transfusion. Now I'm going to stay with you for the first 15 minutes. I'm going to be doing some paperwork. If you have any questions, ask me. I'm also going to tell you some signs and symptoms. If you feel any of those signs and symptoms, you're going to call me if I'm not in the room. Okay, start. Before it starts to get angry. All right, so now we're going at 60 is your rate. This is your volume. And everything is open right now. And that's open. And that's okay. So now what I'm going to be doing is I'm going to talk to him about signs and symptoms, and then I have to fill out my paperwork. All right, so let me go over here, and I'm going to take my paper here, and I'm going to talk to Mr. Campos. I have to let you know that if you start to feel any signs and symptoms, such as chills, if you're really cold all of a sudden, or warm, if you have a headache, if your chest starts to give you some pressure pain, if you're starting to have shortness of breath, if you feel like the severe, terrible itching all over your body, all of a sudden it just came on. If your back hurts, I want you to call me right away, right? Your call light is right here on your hand. Keep it on your hand all the time. And then I will come and I'll do something about that, all right? Okay, so if you forget all of these signs and symptoms, just ask me every time I come in here, because I'm gonna be coming to see you every 30 minutes. When this blood is transfused, but right now I'm staying with you for the first 15 minutes here in the room. All right, I'm going to do some paperwork, and then when this is going to be done in about 15 minutes, this rate here that I put in, when it alarms or when I look at my watch, it's going to be say 15 minutes. I'm going to take some more vital signs, and I'll remind you again what I'm doing. All right. I'm going to go here. So the first thing I'm going to do is put in the vital signs that I took before I left. They have to go in here where it says pre. You need pre-vital signs, which are them. Okay. So, pauses. 18, and we have a 36 over 82. That's the first set of vital signs. So I need to fill out this portion here. Started by me, okay? And today's date is
16.
16, right? Mm-hmm. And then I will say 1 o'clock? 4. Okay, 4 o'clock. So it'd be 1600, right?
Mm-hmm.
Yeah, military time. Okay. 1600, and we have, they're talking about a filter. This is your filter here. It's just a standard filter. There's nothing special about it. If it was a special filter, the doctor has to give you an order for that, and the lab has to find it. So standard, and they're saying, is there a blood warmer? No, there isn't, so I'm gonna put a little note here. No, there's no blood warmer, and I can leave this for the end. My transfusion is done, all right? Okay, so just so we can go a little faster. Mr. Ocampo, how are you doing? How are you feeling? Any discomfort anywhere? Discomfort here? Any discomfort anywhere in your body? No? All right, so what I'm gonna be doing, just gonna adjust some numbers here, and then I'm gonna let you go know when I'm leaving, and when I come back every 30 minutes, you let me know if you need anything, all right? Okay, so leave that call light in your hand so you'll know where it is, okay? So now I'm gonna come over here because it's been 15 minutes, and I'm gonna go back to channel select, okay? And I'm going to go back into the rate. So I have 446. Does anybody have a calculator? It's 446. I'm gonna divide that by 4.
446 divided by 4, 111.5.
Okay, so we'll make it 112.
112.
We can go up for the decimal. Okay, we're gonna highlight the rate. 112, right? Yeah? Okay, so I'm gonna say now I change the rate, and I'm gonna go ahead and restart it. Let's just go over here sometimes. It doesn't know what it wants sometimes. Okay, so there it is, 112. This is gonna be my new rate. This is the true rate for the next 3 hours and 45 minutes, whatever I have left. Okay, so we will get this blood in at this rate. We'll get it in less than 4 hours. Okay, it'll be a little bit early, but that's fine. We don't want to go over 4 hours. Okay, so now, Mr. Ocampo, okay, so I did some adjustment on your numbers here, and your blood is going to go now for the next few hours. I will let you know exactly when it's going to be done, so that way you'll know. Okay, any discomfort? No discomfort. Okay, so remember, I'm going to come in here and I'm going to be asking you questions about how you're feeling, and I'm going to be looking at your IV site to make sure that there's no inflammation or redness or any leaking here. If you do feel some wetness, call me so I can come and check it. All right? Okay, so he is comfortable. His side rails are up, and I'm going to be going out to do whatever I need to do out there. So I'll come back every 30 minutes to check up on you. Okay?